Welcome to virtual orientation for second year and third year interns for fall 2020 for community eye care. You will have patients at Western. Let me introduce you to the team. We've got Dr. Jennifer Pate on Monday mornings, Dr. Gerald Simon on Monday afternoons. I, Dr. Janine Sims, will be on Tuesdays all day and Friday mornings. Miss Hazel Williams is our customer service rep who will be there all 5 days. Dr. Alexia Vaughn is on Wednesdays all day. Dr. Crystal Mahari is on Thursday mornings in the spring, but for the fall, she will be at primary care. And on Thursdays all day, we have Dr. Gisetta Cargas. So welcome from the Community Eye Care team. What began in 1973 as a screening program that lasted throughout the second year has changed and developed to include full eye exams at a health clinic as well as throughout the state. The Community Eye Care program has been around for almost 47 years, and its emphasis is placed on improving the intern's proficiency in basic optometric skills and providing an opportunity for them to use these skills in non-traditional clinical environments. The CEC program continues to seek out new opportunities and to interact with various communities as it represents the School of Optometry and the University of Alabama at Birmingham. Second year interns entering community eye care are taken concurrently with CVS. You've been taught basic techniques including visual acuity, cover tests, retinoscopy, and direct. This program hopes to enhance those techniques on actual patients through pediatric and adult screenings. This year, because things are a little different in terms of screenings, and second year interns will be involved in COVID screenings and patient workups for our third and fourth year students at Western Health Center. Additional screening venues should be added in the spring, and these will include adults as well as Head Start children for JCCEO. Interns are graded daily on their performance as an examiner or captain for the team. Please consult your CEC manual for an explanation of duties and responsibilities of team members. Sometimes during the term, you may have a quiz or written exam, and these will count as 25% of your overall grade. Our grading scale is the same as that for our didactic courses, A, B, C, and F, with A representing consistently above expected levels of performance. If the course goes virtual due to changes in the pandemic, it will be a pass-fail course. Because we must observe social distancing while in clinic, Western will be a mixture of hybrid and in-person encounters for the second and third year interns. So here's a breakdown of how things will be graded for your in-person encounters as 75%, your virtual participation, and your written exams will count for the other 25%. What if you need to miss clinic? We ask that you submit an absence request 4 weeks in advance. This may be done electronically or on paper, and we may also use MetaTrek because there's an absence request platform for that as well. This must be signed and approved by your attending and the service director. This makes it a lot easier if you do it electronically because we can just email each other the forms. If your absence is unexpected, we ask that you call 975-2020 or 996-6038. If no one's there, please leave a message. You should also text your attending and the captain. You've got all our cell numbers and contact information on the right. You must make up the time missed for an absence. You will receive an incomplete until the absence is made up. How do you make up the absence? Well, you will actually do black belt clinic or participate in weekend screenings. We usually do not let someone make up during regular clinic session unless they are filling in for someone else who is absent. All of your makeups must be approved by the service director. Although this rarely happens, I have to bring up a student warning, and this is issued because of improper conduct, clinic attire, you're late for clinic, you're just not doing what is expected. If you receive 2 warnings for the same term, this will actually cause a reduction of a letter grade in your final grade. So we want to make sure you don't get a student warning. This year, you probably will not get one for improper student attire because we will all be wearing scrubs. So that makes it pretty simple. Our Corona dress code includes scrubs that we want you to clean every night, as you will be wearing them multiple times per week. You may also want to invest in another pair so you will not have to clean them every night. We're not wearing our clinic jackets right now, but when we do start back wearing those, they should be laundered each night as well. You should avoid loose jewelry or watches. If your hair is longer, you want to make sure that it's tied back. And in terms of facial hair, it's impossible to wear an N95 properly if you have a beard or a goatee that's not trimmed or manicured. So we want to make sure that you take care of those things as well. Here are the captain's duties and responsibilities. We want you to arrive 8 a.m. or the time specified by your instructor. On those first few weeks to learn where everything is, I suggest you get there before 8 o'clock, possibly 7:45. We want you to do a temperature check as soon as you arrive. This is located in the Springer Conference Room. You can check your temperature. If you're less than 100 degrees Fahrenheit, you're good to go. You don't have to call the screening sites for the fall because you will all be going to Western Health Clinic and they will be expecting us. Your co-captain is going to check out the equipment prior to departure, and we want to make sure that there's at least a half tank of gas in the van before you return. For social distancing, we can only operate our vehicles at 1/2 capacity. So that's for our 12-passenger van, 6-person maximum. For the minivan, only 3 persons. Captain is responsible for coordinating the screening setup, that's the flow, also monitoring clear wave at the health clinic, frame selection in optical, sanitizing things in optical, and the co-captain will inventory the supplies and drugs needed for our cases and also for the health clinic. The captain is responsible for communicating with the team. An email is sent out the day before with assignments to the team members, to Miss Hazel, and to your attending. If you're not quite sure what to put in your initial email, your attending can guide you for those things by giving you an example of one from last year. The clinic coordinator or attending will notify you whether you need to bring additional items, and you should look for a basket on Miss Hazel's desk, and it's a yellow basket that I will show you a little bit later. And sometimes the team from the previous day will ask for things and we will put those on the desk. The third and fourth years will be responsible for the yellow basket. For second year interns, when we get back to our regular screening schedule, you will need to call your sites, and the schedule will be color coded, so it sort of lets you know, is it an adult site or is it a pediatric site? What equipment exactly will you need to bring? You want to call them the day before to confirm. If you are seeing someone on a Monday, you will need to do the confirmation on Friday. These sites usually are done with most of their business by 2 p.m., so you want to try to call them early. If you wait until 5 to call, you will not get anyone. We don't want you to Google the addresses. Your site and contacts information that is included with your manual should have the up-to-date information. If the information is not up to date, we want you to please notify your attending and the clinic coordinator so that we can update the manual. What are the responsibilities of the team members? We want you to arrive promptly at 8 or the time specified by your captain. You will also have to do a temperature check upon arrival. We want you to sanitize the van. So we've got some spray bottles and some paper towels. We want you to wipe down the steering wheel, seats, door handles, places, areas where people will frequently touch. We want you to assist the team co-captain in checking the equipment cases. You will also have to set up and break down your assigned lane or station. You should report missing equipment and supplies to your team co-captain. You will also assist in sanitizing the rooms and stations at the end of the clinic session. It is important to return all materials and supplies to their appropriate location so that the team coming after you knows where things are. You should also cover all equipment and turn off lights when we are done at a screening site or at a health clinic. In a white notebook located in the CEC closet, there's an inventory sheet. So the captain and co-captain are responsible for making sure we have the equipment that we need before departure. Everyone should pitch in to help, work together as a team. So if you're not captain of or co-captain, by showing up, learning where things are, you will be prepared when you are the captain that day. When I give my tours to show you where things are located, it helps to actually be there so you're not lost when it's your turn to be captain. You want to file the inventory sheet in the white notebook when you're done for the day, and if we're low on copies, you need to make copies of the inventory sheet to put in the back of the notebook. As mentioned previously, you want to check your fuel level before you leave and make sure you can gas up. Sometimes our locations are farther away, and if you go somewhere and it's really busy, you may not have time to gas up after you're done in order to make it back to get lunch before your 1 o'clock classes. So it's important to check these things, and you can leave a little early to make sure you have the fuel you need. Your sanitary kit is also located on the van, and this is something you'll need to check prior to leaving. It has extra sanitizer, gloves, and tissues, things of that nature that are definitely important during this corona season. The third year interns may notice that the van parking has changed a little bit since last year. Because we had several accidents with our new van, we are moving it to a new location so that the pole will not be as much of a hindrance. I would also recommend that someone stands outside of the van when you are backing out to guide the driver. Some of you may not be used to driving larger vehicles. So the new van is located now the first parking space when you enter the lot. In order to park there, you will need to circle around the entire lot and you can pull straight in, and it makes it really easy for backing out. The eyesight van is parked in the first parking space um, uh, where the bigger van used to park. In terms of personal equipment, you need to make sure you have a mask. We will supply one for you daily in terms of a surgical mask. You'll need to bring your cover paddle, your blood pressure cuff and stethoscope, and your diagnostic kit, a pen light, and a near fixation target. You will also need to bring a pen in order to record things with. The third and fourth year students will need to bring a BIO, condensing lenses, and a trial lens set. You probably only need about one trial lens set for the entire group because we do have some trial lenses out at Western. Everyone, especially the captain, should bring their CEC manual because it has some little tidbits in there in case you forget some things from this orientation. After you complete your screenings, you will need to complete a log sheet. You will post a copy of the log sheet on the bulletin board in the CEC closet only if items are needed. You will record these items under the supplies needed. If something happened to a piece of equipment and it's not functioning properly, you can put that under the comments section. But this acts as a record to let the next person know that something is not acting as it should. You should not post any blank forms. If you are the next group coming after this group, and you are able to replenish some items, you can cross the things off that list. But if you complete everything on that list, you can take the sheet down and throw it away. Your log sheets should include the number of failures, passes, and totals. And by total, I'm not referring to a hash mark. We want you to actually record a number, so this makes it easy for data entry for the clinic coordinator. You should turn off the light and push the closet door almost closed. You can leave it open for the afternoon team. If you are the afternoon team, the door should be locked once you hang the keys back up in the closet. When you are done for the day, you bring the original copies of the screening forms along with your log sheet, and you're going to put them in the clinic coordinator's desk. Blank forms are also located in the file cabinet across from the clinic coordinator's office, and that is located in the business office in room G80F. When you're bringing the originals back, make sure for the kids you bring back the top of the carbon copies because it's easier to read when you're doing a report. For the adults, since we do not do a report, you can bring either copy, but I usually let the patient keep the top copy because it's easier to read. This is what a screening form looks like for pediatric screenings. You will not need to get screening forms for the pediatrics kit because these items will have already been mailed to the sites prior to our arrival so that the teachers can assist in completing the top portion of the form. If there are things on the top part of the card that are not filled out, it is the captain's responsibility to make sure we get that information. We don't need their birthday, but we need their age. We need their race and gender in case we want to use this information for a study or something later on. Does the child wear glasses? If they did not bring their glasses, we also want to note that as well. The team members are going to record information on the left side of the form for the stations: visual acuity, retinoscopy, cover test, direct, and color vision. The right side of the form is only for recording for our captain. So no one except the captain and the attending should be recording things on the right side of the form. Color vision is binocular. You're taught to do it monocularly for an exam, but for a screening, we perform the test binocularly. Depending on the size of your rooms, you can use the good light chart at 10 feet, or you can use the tumbling E chart at 5 feet for your pediatric screenings. Sometimes the tumbling E is harder because it relies on coordination of the hands as well as vision. So the good light and the Leah charts work well. The Leah charts are great because we have a symbol that the kids can point to if they don't know what the shape is called. And again, this is a 10 feet test. Tumbling E is 5 feet away, and you record it on the screening form next to the appropriate area. The failure criterion will change depending on the age group of the child. Are we seeing preschool kids? Or are we seeing school age kids? So the Orenda study was based on school age, and because the eyes develop differently, a failure for a 3-year-old is different than a failure for an infant or for a second grader. We will elaborate a lot more on these things when you start your vision screenings in the spring. Here is the criteria for failure based on the Orenda study. We've got 20/40 or less. We've got a certain amount of hyperopia, myopia, astigmatism. Are the eyes crossed? Do they turn in or do they turn out too much? Do we have a congenital cataract? Do we have something else going on? If a child fails color vision, they will not fail the vision screening. We just want to make the parents and the teachers aware of this color vision defect, because we don't want someone not to do well on a test because they chose the wrong crayon to color. Here are a few tips when working with preschool children for color vision. Some kids can complete the test without any problem, but we don't want to fail a 2-year-old because they could not perform the test. So just record could not perform on the card. In terms of visual acuities, sometimes kids do not like to guess at small little tiny letters. So if they won't guess, that's fine. You may have to treat them more like an infant by doing fix and follow, and you can record that on their exam form as well. Cover test, you tell a child to look somewhere and they look somewhere totally different. That's fine. You may do Hirschberg or Bruckner to determine eye alignment. Retinoscopy, the ranges are different depending on the age of your child. We'll go into a lot more detail of this in the spring. The reason I told you earlier not to write on the right side of the screening card for the kids is because it's the area where the captain will need to record things in layman's terms. So the vision was 20/60. You're going to say reduced vision in the right eye, left eye, or both eyes. For cover test, eyes tend to turn out or in for aphoria, or eyes turn in or out for atropia. Nystagmus, we've got dancing eyes or rapid uncontrolled movement. For retinoscopy, we're either nearsighted, farsighted, or astigmatism, or we have a difference in focus between the eyes. You fail color vision, and if we note some type of disease, we're just going to say what the disease is. We've got a conjunctivitis or cataract. Here is the adult screening form history portion, and the person that the captain designates for registration can assist with these for the senior citizens. If you go to a location where it's a working population, we usually give them a clipboard with a pen and they record the information on the sheet themselves. A lot of the elderly do not like to record their age, so they don't have to put it on there. We mainly want to know, have they ever had surgery? Do they wear glasses or contacts? When their last eye exam was? Who saw them? If they don't remember the name, that's okay. If they use any medicines or drops for their eyes, what these are for, and just a brief history in terms of blood pressure, heart disease, diabetes. The next portion on the adult screening form is where we actually take some measurements. We want to know what their best vision is. So if they come in wearing glasses, do you wear those for up close or for distance, or where, if however they wear their glasses, that's how we want you to record them. If they say, I take my glasses off, measure their best VA, removing the glasses for reading. On the vision tester, you will also test their peripheral vision or their side vision, and if they're able to get the nasal, you just check yes. And for your temporal visual field, we want to record the degrees that they get. We typically don't do color vision for our adults and stereo. That was more so when we were screening the athletes. You'll get their pressure, their blood pressure, slit lamp, and direct. Your clinic manual also contains the adult referral criteria, and the 20/40 acuity is still in there for one eye, both eyes, either eye. The side vision, if they don't give us a response, that's a failure, and if it's less than 85 degrees for temporal, that's a failure. If a person may not be understanding the test, you may want to do confrontation visual fields. We also are going to do the FDT at Western, so that's a little more sophisticated visual field machine. For tonometry, we're going to do Perkins or the tonopen. If their pressures are greater than 20 in either eye or 5 mm difference, we want to do Perkins. Stereo, we typically don't do. Color vision, we don't do. And we look in the back for disease. We can also fail them for their blood pressure. So you want to refer to the chart when we're making recommendations for that. In order to measure our visual acuity for our adults, we're either going to use the Optec 2000 vision tester or the Good Light chart, which is a 10 feet chart. The great thing about the Good Light chart, you don't have to worry about sanitizing the machine each time. You just sanitize your cover paddle. You may even choose to let your patient use the palm of their hand to cover up an eye for distance visual acuity. So that cuts down on the sanitation process. If you are measuring blood pressure in an adult, we want you to try the automatic arm cuffs first instead of the wrist cuff. The wrist cuffs that we have in our kit are not the best ones, so they don't tend to give us an accurate reading. If the cuff is too tight, you need to switch to the larger cuff. One team member should always remember to bring their manual blood pressure cuff and stethoscope. You need to make sure you sanitize your equipment after every patient, whether it's your personal equipment or the auto cuffs from the adult kit. When measuring tonometry, you should always remember to store your tonopen with a cover on it. You can leave a dirty cover, but a cover must be stored on there in order to protect the sensors. If it becomes dirty, it becomes inaccurate. So store it with a cover on. For adult screenings, it's important to do Perkins tonometry on all patients who come in telling you they have glaucoma. It's the gold standard because it mimics the Goldman, like on the slit lamps. If IOP is a failure with tonal pen, we also want you to do Perkins. If there's an asymmetry of the IOP, you should do Perkins. Where can you find items that are not in the CEC closet? Well, the clinic coordinator's desk is the G80F located in the business office. You can get a key to this door from Elizabeth or any of the other clinic coordinators if the door is not open. In the bottom drawer of the file cabinet, you will see the portable slit lamps as well as some extra tonal pens. You don't really need those because there's always one in the adult kit already. Make sure you return things to where you got them at the end of the day. And also make sure that you put the slit lamp that is labeled for a certain case. The chargers are not interchangeable, so it's important for them to be stored properly. As part of the workup for our adult patients at Western, the second years will be performing FDT screenings on the patients. This piece of equipment has already been taken to Western. You will just need to make sure you sanitize it between each patient, enter in their age, and we are going to do the screener. Print this out. You will tape it on a progress note to give it to your fourth year or third year intern when you give them the patient. The bottom part of the adult screening form is for the captain to determine if the patient passed or failed the screening, and also for the team members to record things that we may not have heard during the history. Oh, I didn't take my blood pressure medicines this morning, so my blood pressure is a little bit high. If we're recommending a certain type of teardrop or lid scrub or allergy medication, we can record that information in the notes section. If by chance you're at a mall or something and you're screening adults but some kids may come in, you can also record your retinoscopy in that area.
Welcome to CEC at Western. Come on in. Come on. Community Eye Care, how are you today?
I'm good.
Good.
After the patient calls the eye clinic or checks in through mobile check-in, the customer service rep will alert them to stay in their car until an intern calls them. We will then change their status in ClearWave to ready for COVID screening temperature history. Next, the provider or the intern will call the patient for the COVID screening. You will dial *67 before dialing their phone number from your cell phone. The questions include: have you been tested for COVID-19 in the past 2 weeks? Have you been in contact with someone under investigation for it? Have you or a family member been instructed to self-quarantine? If the answer is yes to any of the questions, this equals a positive screenings. If the patient can provide documentation of a negative test result, they can gain entry to the facility. If they cannot, please talk to your attending on how to proceed. If the answer is no to all of these questions, you can proceed with testing. Do you have a cough or shortness of breath or difficulty breathing? Or do you have fevers, chills, repeated shaking with chills, muscle pain, sore throat, new loss of taste or smell? If you have no answers to all of these questions, you can proceed on to the temperature screening. If a patient has symptoms but there is an actual eye emergency, please consult with your attending to determine how to proceed. We may have to refer the patient to Callahan or to the emergency room depending on the scenario. After you've completed the COVID screening questions, go downstairs to the first floor with hand sanitizer and the infrared thermometer to take their temperature. Offer them the sanitizer so that we can make sure their hands are sanitized before entering the clinic area. You want to aim the thermometer at their forehead about 3 to 5 centimeters away. Press the trigger button and it should light up. Sometimes it may say low if you're not really on their forehead, so you can try it again. If your reading is 100 degrees or less, the patient can proceed with the exam. Please take them to the pre-testing area.
You can go ahead and step inside. We'll do your temperature right here. Stand right here for me. All right, you're clear to come in the building. You can follow me.
Next, the second or third year interns will escort the patient to the pre-testing area. Here they will perform visual acuity, history, autorefraction, blood pressure, and maybe even visual field before the patient enters the exam room. Make sure you sanitize all of your areas between patients.
Now we're going to use this machine to get an estimate of your glasses prescription before we take you back, okay?
Okay. All right, so we've done everything we need to do. I'm just going to take you back to your exam room.
All right.
So your exam room has already been sanitized, and you'll just have a seat in the big old chair right here,
All right.
and we'll begin your exam.
Sounds good.
Your exam rooms are stocked with cleaning supplies, eye drops, and tissues. Make sure you clean your equipment between each patient. This includes your occluder, your prisms, your dropper bottle tips, phoropters, slit lamp shield, exam chair, condensing lenses, and imaging equipment. It's important that we do this between each and every patient. When your patient is dilating, you may choose to hand off your patient to optical, but remember, only one person is allowed in optical at a time. If your patient is a child, you may choose to do the frame selection in the room. If they are purchasing glasses from the board, they will have to go to optical. We will also offer dispenses and curbside pickup as an option for patients. You want to make sure you disinfect after every use. This is the frame board where patients will choose their glasses when purchasing glasses. They can get progressives, AR coatings, high index, all the extras they like if they purchase them, and we have a discount rate. All the frames are free, so they're basically only paying for the lenses. On the other hand, if you have patients with a VSP voucher and those who have Medicaid, they cannot get any extras on the glasses. So for Medicaid, we have a polycarbonate lens, either flat top bifocal or single vision, and for the VSP voucher, we have single vision or flat top of the plastic lenses. If you're doing a frame selection for a Medicaid adult, that will occur at this table in optical. For Medicaid children, you can take those lenses to the room or do optical, and for the VSP voucher, those are also in a case that can be easily transported to the rooms for frame selection. When your exam is over, please escort your patient to the front desk for checkout. Here they will reschedule appointments and pay co-pays as well as pay deposits for glasses. For patients with vouchers who will have return visits for further testing, it's important to tell them what their co-pay will be at that visit. At the end of the day, it's important to clean up your room and get it sanitized for the next patient. So you want to make sure all of your bottles and everything, your drops, are put back in the drawers or in the cabinets so that your shelves can be easily sprayed and wiped down. And you should also make sure your equipment is covered. There are some common areas that need to be sanitized as well. This includes the front desk, computers, frames and opticals, sub-waiting chairs, the thermometer. All of these things are shared by everyone, so we are all responsible for making sure those areas are clean. I think that's a wrap for orientation for fall of 2020. We want everybody to complete their health check daily, wear their mask, and practice social distancing, and we should have a great year for community eye care.